Discuss about the clotting cascade mechanisms and certain bleeding disorders. At the end of the lecture, the student will be able to define the mechanism of blood coagulation, the extrinsic and intrinsic pathway, and certain bleeding disorders. Hemostasis is the prevention of blood loss. It occurs by two mechanisms, the primary hemostasis and secondary hemostasis. The primary hemostasis is concerned with the formation of the platelet plug if the rent in the vessel wall is small. If it fails to repair the vessel wall, then secondary hemostasis comes into action and it stabilizes the platelet plug by the formation of fibrin meshwork. The initial step of hemostasis is the vasoconstriction. The vessels constricted by the initial injury of the vessel wall. The second step of hemostasis is the aggregation of platelets to form the platelet plug. And the third step is the clot formation. It is the secondary hemostasis in which there is formation of the fibrin meshwork around the platelet plug. The fibrinolysis is another mechanism which occurs after the clot formation, and the clot is either removed by the dissolution of the clot or it is washed away by the circulating blood. So the coagulation of blood is the conversion of fibrinogen to insoluble fibrin meshwork which occludes the point of vessel rupture. The clot begins within 15 to 20 seconds if the trauma of the vascular wall is severe, and in 1 to 2 minutes if the trauma has been minor. Different substances within the blood are activated by the traumatized vascular wall, platelets and blood proteins which are adhering to the injured vessel wall. The clotting time is 3 to 6 minutes in which clotting is completed. After 20 minutes to an hour of clotting, the clot retracts, that is, it begins to contract, bringing together the damaged ends of the vessel still closer. Due to clot retraction, the fluid oozes out from the injured vessel, which is known as the serum, but it is devoid of the clotting factors and fibrinogen, as these clotting factors have been consumed in the coagulation of blood. So the clot is formed of fibrin fibers, entrapped blood, within these fibers, platelets and plasma. The blood coagulation depends on the balance between the coagulants and anticoagulants. In normal circulation, the blood doesn't clot due to the presence of anticoagulants. The procoagulants are the substances, proteolytic enzymes, which promote clotting, whereas anticoagulants inhibit coagulation. The clotting mechanism involves a cascade of reactions in which clotting factors are activated. These are synthesized by the liver, and some of which are vitamin K dependent. It means that vitamin K is necessary for their production. Such clotting factors which depend upon the vitamin K for their synthesis include the factor 2, 7, 9 and 10. When activated, these clotting factors act as the proteolytic enzyme to activate other clotting factors. This is the list of clotting factors. Factor 1 to factor 13, beside which includes the prekallikrein, high molecular weight kininogen and platelets. The general mechanism of clotting occurs in 3 essential steps. The first step is the formation of prothrombin activator. The prothrombin activator is formed by another mechanism which is known as the coagulation cascade pathway, extrinsic pathway and intrinsic pathway. After the formation of prothrombin activator, there is the conversion of prothrombin into thrombin under the influence of prothrombin activator, and then thrombin acts as an enzyme to convert fibrinogen into fibrin fibers. So the first step in the coagulation cascade is the formation of prothrombin activator, which is the rate limiting step in the coagulation cascade. This prothrombin activator causes the conversion of prothrombin into thrombin, then thrombin activates the fibrinogen into fibrin monomer. The fibrin monomer then combine to form the fibrin fibers. The fibrin fibers are stabilized by the fibrin stabilizing factor, and this fibrin stabilizing factor is present in the blood, which is activated by the thrombin, or it is released by the platelets. The fibrin fibers then develop the covalent bonds around themselves to form the stabilized fibrin fibers. The initiation of clotting depends upon the trauma of the vessel wall, trauma of the surrounding tissues, trauma of the blood itself, and contact of blood to damaged endothelium or exposed collagen. All of these can lead to formation of prothrombin activator by two pathways, which are the extrinsic pathway and intrinsic pathway. The intrinsic pathway is activated by the elements present within the blood itself, and it is activated when there is trauma to the blood. It starts with the platelet phospholipid or contact of blood with the exposed collagen. The extrinsic pathway is activated due to the tissue factor or tissue thromboplastin in response to injury to the tissues. It is the rapid clotting mechanism. Both the mechanism results in the formation of prothrombin activator, and they occur simultaneously and interact with each other. You can see here the overall mechanism of clotting and the production of prothrombin activator. The intrinsic pathway, it is activated by the exposed collagen or the platelet phospholipids. It causes the activation of factor 12, factor 11, factor 9. Factor 9 then causes the activation of factor 8, which results in the activation of factor 10A, which then follows the common pathway between the intrinsic and extrinsic mechanisms. The extrinsic pathway is initiated by the tissue factor. It causes the activation of factor 7. Factor 7A leads to the production of factor 10A under the influence of factor 8A, and the factor 10A then under the influence of calcium and factor 5 causes the production of prothrombin activator. Prothrombin activator again then causes the conversion of prothrombin into thrombin, and then thrombin causes the conversion of fibrinogen into fibrin. This is the mechanism of extrinsic pathway occurring in the three steps: tissue factor, factor 7A, which causes the activation of factor 10A, and factor 10A finally results in the production of prothrombin activator under the presence of calcium and factor 5. This is the intrinsic pathway, starting with the blood trauma or contact with collagen. There is activation of factor 12A, 11A, factor 9, factor 8, and which causes the activation of factor 10A to form the prothrombin activator. The bleeding disorders may be hereditary or acquired. The hereditary includes the hemophilia A, hemophilia B, von Willebrand's disease, and acquired bleeding disorders include the vitamin K deficiency, fibrinolytic defects, liver diseases, and disseminated intravascular coagulation. The deficient clotting factors are due to the vitamin K deficiency, which occurs as a result of liver diseases such as hepatitis, cirrhosis, and liver atrophy. Vitamin K is formed normally within the intestine by the intestinal flora. If it is deficient, it causes the insufficiency of the clotting factors, which are vitamin K dependent, such as prothrombin, factor 7, 9, 10, and protein C. Vitamin K is deficient in malabsorption diseases of GIT, or it may not be absorbed due to the lack of the bile, as occur in chronic liver disease or obstruction of the bile ducts. Hemophilia A or classic hemophilia is another bleeding disorder in which there is deficiency of the factor 8, the smaller component. It is transmitted by female chromosome as a recessive trait, and it is X-linked and occurs exclusively in males. The bleeding occurs only after the trauma and can be treated with infusion of the factor 8 or liver transplant. The hemophilia B is also known as the Christmas disease. It occurs due to the lack of the clotting factor 9. It is also X-linked, but it is the rare genetic disorder treated with the infusion of factor 9. Von Willebrand's disease is another autosomal recessive genetic disorder which is due to the formation of defective von Willebrand factor, a clotting protein. This von Willebrand factor is due to the defective larger portion of the factor 8, in which there is defect in the platelet plug formation. The platelets doesn't combine together to form the platelet plug. In this way, it prevents blood from clotting properly. Thrombocytopenia. Thrombocytopenia means low quantity of platelets in blood. Normally, the platelet count is 1.5 lakh to 3 lakh platelets per microliter of blood. Bleeding doesn't occur until the number of platelets fall below 50,000 per microliter, and it is lethal if the platelet count decreases below 10,000 platelets per microliter of blood. Small punctate hemorrhages occur throughout the body under the skin, which show small purplish blotches, giving the disease the name the thrombocytopenic purpura. These are the causes of thrombocytopenia, which may be due to increased destruction of platelets or decreased production of platelets. Such as blood transfusion, HIV infection, hepatitis C, sepsis, pregnancy, tick-borne rickettsiosis, certain medicines, Epstein-Barr virus. Medicines such as heparin, quinine, and rifampicin, ranitidine, all these cause thrombocytopenia. The treatment of thrombocytopenia is the whole blood transfusion with adequate platelets, splenectomy, because the spleen is the organ where the platelets are destroyed, immunosuppressants, corticosteroids, and different drugs such as rituximab, thrombopoietin receptor agonist drugs, intravenous immunoglobulins. The idiopathic thrombocytopenic purpura is the deficiency of platelets due to unknown cause. There may be presence of autoimmune antibodies which destroy the patient's own platelets by phagocytosis in the spleen. Again, the treatment is whole blood transfusion and splenectomy. Disseminated intravascular coagulation is the activation of clotting mechanisms throughout the blood vessels, and it results from the presence of large amounts of traumatized or dying tissues in the body that releases great quantities of tissue factor into the blood. It causes the diminished number of clotting factors remaining in the blood, which will lead to the bleeding. It may occur in septicemia, where bacteria or bacterial toxin such as endotoxin activate the clotting mechanisms. The bleeding occurs as a result of consumption of platelets and increased consumption of clotting factors. The symptoms of disseminated intravascular coagulation is bleeding, GI bleeding, petechiae, ecchymosis, IV line and catheter bleeding, renal failure, pulmonary involvement, which may cause the dyspnea, hemoptysis, cough, jaundice. This is the difference between tachy, purpura and ecchymosis. Smallest one are the petechiae 1 to 2 millimeter. Then larger dots beneath the skin are purpura, and ecchymosis are the large bruises over the skin.